I really love meeting in this place with all of you. I think one of the best things about City Club is the networking. So I love seeing that people are having conversations at their tables. And I hope you take what you learned from today to your friends and, inspire some conversations about what our speaker has to say today. And sort of in that light, I'm curious about who's here today. So how about people here for the first time? Can you raise your hand? Oh my gosh, that's great. That is really wonderful. And how many brought a friend today, invited somebody? We love that because we're trying to diversify so that more people know about City Club in our community. And that is the best way, is to invite them to come. So how about people who are new members? I'd like to acknowledge those. All right, if you're not a member, we invite you to join. And you can do that with Zach over at the table at the entrance, and he can sign you up. So I heartily encourage you to get that membership because it does save you $5 off of your meal. And kind of like a Costco membership, it sort of pays for itself. During our comments today and the speaker, just make sure that your cell phones are silenced. Sometimes beeps come through, sometimes calls come through, and it's just kind of embarrassing when it happens. So thank you for doing that. As always, I'd like to thank our program committee who is responsible for these wonderful speakers. They are working like 6 months in advance on topics of interest locally and nationally, and then securing speakers who really know what they're talking about so that we can have the privilege of having them here in this space in person. So I just want to, maybe a round of applause for our program committee because they work really hard. Also to everyone else that makes it happen, Zach is the one who sits at the table. He is our treasurer. And the people who do all the logistics, Sam is in charge of that. People who greet you at the table or at the door or at the table where the name tags are all volunteers. So if you are interested in volunteering, let me know. I'll be here after the meeting. Just come up and we'll get your name. And if you'd like to help us pull some of these things off, that would be just lovely. Also, I'd like to thank the Yacht Club for providing this beautiful space, Talking with Crows for our videography, and also our caterer, Good Bowls. Let's just do a round of applause for them. Thanks. And let me not forget Dave Donnelly, who's doing our sound and has fixed a lot of the sound issues that we were having before and now are minimized. Yay, that's been wonderful. I'm working one-handed here today. I went to Croatia and brought back a souvenir. But I don't want to stop speaking without acknowledging our sponsors. They're really important for the City Club to continue to do what we do. And if you have a business or an organization that would like to sponsor, we would welcome that. And Jim Britton here at the front table, raise your hand, Jim, real high. He's the guy to talk to. And on that light, I'd like to welcome some new sponsors. We have Puget Sound Energy. We have some renewals with, also I wanted to say Pacific Northwest Radio Group has been providing some wonderful marketing for us in kind donation. And then some others, Peace Health St. Joseph Medical Center, Baron Quinn Maxwell, Bruce and Claudia Descend, Danny Neal Real Estate with Moliat Group, Firehouse Arts and Events Center, Colshan CPA, that's Zach at the front table, Opportunity Council, Pacific Continental Realty, Unity Care Northwest, Village Books. Thank you for being here, Village Books. Western Washington University, Whatcom Community Foundation, and Salish Current. Did I miss anyone? Hope not. All right, but we do thank them for their wonderful support. It's essential for us to be able to do what we do. So I have an important announcement. The Bellingham City Club has been looking at our budget and the costs that we have incurred to do what we do. And if many of you have been with City Club for some time, you might remember Northwest Hall, where everything was pretty much turnkey. We are very lucky to be here in this space and have our caterer, but the costs for everyone are going up. So please watch your email for an announcement about dues for 2026. And there'll be a modest increase, but we think it'll be worth it and it'll allow us to continue to provide the benefits that we do to all of you. So thank you. So I think I'm going to turn the mic over to our esteemed program chair, Jane Bright, and she will talk about our speaker today, Alan Lifson. Thank you all for being here and happy holidays.
Thank you. In my next life, I'm going to be 5'8". We've been working with Alan for many, many months about this program, and I cannot tell you how much effort has put into it. It's a little dynamic, changing. And like the content he has for today, I have tried to shorten his bio, and I have failed because there's so much background that is so important, and he's so embarrassed, and we are so fortunate to have him here today. So here we go. Dr. Alan Lifson is a professor emeritus from University of Minnesota in both their School of Public Health's Division of Epidemiology and Community Health and the School of Medicine's Division of Infectious Diseases and International Health. After completing his internal medicine residency and infectious disease fellowship, he joined the Centers for Disease Control as an Epidemic Intelligence Service Officer assigned to the AIDS program. He also served as Chief of AIDS Research for the San Francisco Health Department and head of the Acute Disease Prevention Section with the Minnesota Department of Health, overseeing the state's vaccine program. Author and co-author of over 100 articles and book chapters, Dr. Lifson has worked in multiple countries, including Eastern Europe, Southeast Asia, the Caribbean, and Sub-Saharan Africa, including more than a decade in Ethiopia. His research and other work include Native Americans, refugees and immigrants, gay and bisexual men, injection drug users, COVID patients in nursing homes, and rural Africans. He has contributed guest editorials for the Cascadia Daily News and Seattle Times, and he's a Bellingham City Club member. Alan, thank you.
Thank you, Jane, for that very kind introduction. I don't know who that guy is, but I'd like to meet him. So I first just want to start by saying it is truly a privilege and a pleasure to be speaking to the Bellingham City Club. I've gone to a number of the talks that you've given, and it is truly seeing some of your speakers, and so it is truly a privilege and an honor to be here. So I thank you for the invitation and appreciate it. So this isn't working. So how do we turn this on? I think we need to, I turned my button on. Nope, I think we'd have to turn this, there we go. Well, there we go. All righty. Well, just like the talk, the truth will reveal itself here. So, so here we go. Okay, so the title of my talk is sort of Politics and Public Health. And so I really couldn't start the talk without talking about what is public health. And, you know, I think in a nutshell, public health essentially is what keeps you out of the hospital. Public health is what keeps you out of the doctor's office. So, you know, we go to doctors or our healthcare providers when we're sick. Healthcare providers predominantly deal with individuals. Public health really deals with prevention of disease. And rather than individuals, public health really looks at the population. So As it says here, the science of protecting and improving the health of people and their communities. One of the things I'll talk about is really public health. A good public health response really focuses on some really core foundations, and that's that we have to have a good workforce. It's that we have to have accurate information, and that we have to have good supportive organizations that underpin public health. And as I'll talk about, unfortunately, I think what's happening today in our political environment is really damaging all of these foundations, ultimately damaging at the top our ability to have a public health response. A couple of days ago, I had the opportunity to go to a talk at Indivisible Bellingham where they talked about disinformation. And one of the things they said about disinformation is that in all of the things that we hear, often there is an element of truth. And so these are all things that I want to start out by saying I think people on both sides would all agree on. And I believe in all of these things. Vaccines, like all medicines, have side effects. And when I was heading up an immunization program at the Minnesota Department of Health, we looked at some of these side effects. In some cases, in one case, a vaccine was taken off because of some side effects in very young children. It was replaced by a better vaccine. Absolutely, big pharma and drug companies have problems. The profit motivation, so I think that's absolutely true. Science absolutely does not have all the answers. COVID is a perfect example of how, as we learned more, the answers were clarified and adapted. And having worked with some organizations like USAID and others, absolutely, many government and international organizations are overly bureaucratic. Those are all things that are true. My problem is that these concepts that are all true, I believe, have been used to promote false and misleading statements and policies that I think endanger our public health. So as I'm putting the talk together, I was telling somebody, in some ways, putting this talk together is making me a little goofy because, as Jane mentioned, started working on this a number of weeks ago and then had gotten it down. And then literally every time I opened the newspaper, or every time I looked on one of these websites, there was something new, and I said, oh, I got to talk about this latest disaster or this latest insult. And so I'm actually glad to finally be talking about it so I can stop updating this talk. And so every time I felt like my favorite cartoonist, Gary Larson, my brain was full, something new would come along that would make me say, gee, I have to add this as well. But basically, today I'm going to focus on sort of 4 concepts. And that's how politics have led to gutting of support for the nation's public health agencies, how we've ignored science and promoted unproven, false, or misleading narratives, how severe cutbacks in medical research have prevented new developments to prevent or treat disease, and how we've abandoned our support for global health. And I will try and keep all this. I'm going to talk really fast to try and get everything in. And for those of you who want to stick around, for sure, at the very end, I have some points of good news, so stick around for the punchline. So that'll be at the end. Again, in the interest of time, I'm just going to have to try and pick one example for each of these. And the one I'm going to talk about is something that's very personal to me, and that's gutting of support for the nation's public health agencies, and that's CDC. I worked at, as Jane was mentioning, I worked at CDC for 2 years in Atlanta. I was part of this program called Epidemic Intelligence Service. Those are sort of like the foot soldiers, the disease detectives who are involved in outbreaks and establishing policies. Then I worked at the San Francisco Department of Health, heading up a research study that was funded by CDC. At the Minnesota Department of Health, where I headed up a section on immunizations and refugee health. A lot of our programs were funded by CDC. In academia, I've worked with CDC on various grants. And so I've had a chance to really get to know people at CDC. And I have to say, they are some of the most knowledgeable and dedicated people that I've ever had a chance to meet. And their job of protecting the public health by providing leadership, information, and scientific expertise in preventing and controlling diseases is something that they take very seriously. When I talk about politics, it's hard to talk about this without talking about Robert Kennedy. So I'll say a few words about him. And again, in the interest of time, I'm just going to pick one example, and that's how Robert Kennedy has talked about, who's as you all know, is the Secretary of Health and Human Services, and his anti-vaccine positions and how they've affected CDC. So when Robert Kennedy was undergoing his Senate confirmation, he was asked about his vaccine policies. And specifically, he said during the Senate confirmation, I'm going to do nothing that makes it difficult or discourages people from getting vaccines, and specifically as it relates to CDC. CDC has a number of advisory committees, and one is called the Advisory Committee on Immunization Practices. They develop the guidelines and recommendations for vaccination programs. And he said, I'm going to maintain them. Well, of course, after becoming head of Health and Human Services, as many of you probably know, he fired all 17 members of the Advisory Committee on Immunization Practices. He appointed new members with a history of anti-vaccine activism. And ACIP also has a number of work groups that help to advise these committees, like from the American Pediatric Association, from the Infectious Disease Society of America, and basically all of these work group members with medical expertise were also dismissed. The head of CDC, who, by the way, was appointed and vetted and appointed by this administration, Susan Monteras, was asked to agree in advance to approve all future recommendations that came out of ACIP, regardless of looking at the scientific evidence or regardless of her ability to critique the scientific evidence. She was also asked to fire without cause a number of CDC career vaccine officials. She refused to do this. And as many of you probably know, within less than a month, she was fired by Robert Kennedy, who also said that CDC was corrupt and killing children and they don't care, and was replaced by a former biotechnology executive, James O'Neill, who is heading up CDC, who does not have medical or scientific training. So these have really had severe effects on CDC. Well, it's not just at the head, okay? Since the new administration has come in, over 2,000 CDC employees have been fired. Multiple top health officials have departed in protest, and I'm going to talk about one of them. And this official, who was the chief medical officer and deputy director, said, I resigned because Kennedy's actions repeatedly censored CDC science, politicized our process, stripped agency leaders of the ability to protect the health of the American people. And in addition, the proposed budget for CDC was reduced by $4 billion, representing an over 54% cut, which of course hampers a lot of the CDC activities as well. In addition, some of you have probably heard, this was just this last October, talking about demoralizing CDC. On Friday night, these emails went out saying that there were going to be hundreds of layoffs. Among those dismissed were the two top leaders of the federal measles response team, those working to contain Ebola in the Democratic Republic of Congo, members of the EIS, that I was part of, the Epidemic Intelligence Service, and the team that assembles the weekly Morbidity and Mortality Weekly Report. This is an online publication. It's available free to clinicians, to state local health departments, to the general public, medical schools, graduate schools, and really has the latest information about outbreaks and recommendations and changes in policies. And I won't even discuss the impact of CDC last August when a shooter fired more than 500 rounds into CDC because of the anti-vaccine beliefs. So, you know, all of these have had a tremendously demoralizing effect on CDC. Well, I mostly talked about vaccinations, but again, I couldn't leave this topic without saying that, you know, Robert Kennedy, and again, I totally support the emphasis on chronic disease, but the CDC's chronic disease division has been slated for elimination. The Office of Smoking and Health, and of course, smoking, you know, is a risk factor for cancer, for heart disease, for so many other things, has been eliminated. A number of programs have either been eliminated or significantly reduced: HIV, viral hepatitis, sexually transmitted infections, injury prevention and control programs, including gun injuries and deaths, and even, you know, so critically, the foodborne disease active surveillance network, which, you know, monitors for a number of pathogens that either cause outbreaks or cause foodborne illness. A number of the pathogens that it monitors for, like Campylobacter, Shigella, Listeria, have now been taken off the list of things that are routinely monitored for. So these are all things that have had a major impact on the CDC. Well, I mostly talked about CDC, but again, the problem is sort of bigger than just the CDC. So let's talk about the federal workforce in general. By April 2nd, over 20,000 federal workers have been fired. These include people that are working in food safety, occupational health, outbreak response. I'm going to talk more about NIH in a little bit. I talked about CDC, but also the Food and Drug Administration. And a number of the, NIH has a number of agencies, a number of divisions. Allergy and infectious disease, minority health, child health. And so a number of the NIH agency directors have been fired, including the NIAID director, Dr. Marazzo, who was fired as retaliation for objecting and whistleblowing on the administration's reaction. She said that endangered research subjects and defied the court orders. So the implications of both at CDC and at some of these other federal agencies in terms of the workforce that I mentioned have been significant. The other thing I couldn't leave this topic about workforce without talking about is, we talked about the current workforce, but as somebody who worked in both medical schools and in graduate schools of public health, I know how important training grants and research grants are for the next generation of researchers. So as many of you probably know, there have been significant cuts in funding, thousands of grants to colleges and universities, including termination of training grants, okay? And, the impact of that is that these are grants that young researchers rely upon in terms of developing their careers. So we are not only losing the current generation of researchers, we're losing the next generation of researchers who need these grants to develop their own careers. And so this is the next generation that's going to help us solve the current and future problems that we're solving, that we're dealing with in terms of medicine, in terms of public health. And so we're losing that next generation of medical researchers. And I just found this from the school paper at the University of Washington that said multiple UW medicine graduate programs decreased the number of admissions they offer for 2025 year due to cuts in federal funding supporting research programs. And these were programs like molecular medicine, mechanisms of disease, biochemistry, where in some cases they had to cut the number of admissions by half. So this is not only the current workforce, but we're losing our future as well. So why does this matter to us here in Washington? Well, I just gave one example, but to give another example, first of all, state and local health departments depend upon this leadership from CDC. This is where the center of expertise is. And so we're losing the leadership and expertise to state and local health departments. There's been a number of examples of the damage of this. One is that, for example, a number of the positions that have been cut have been in surveillance. And so one report said states are now losing the early warning systems that they have in terms of surveillance. So if there's an outbreak in another state, another county, somewhere else that's separate, we're losing that early warning system because of the cuts that we've had at CDC. And as you can see, they canceled nearly 700 CDC grants worth about $11 billion. And so all of these have had really significant. When I was at the Minnesota Department of Health, for example, we relied on CDC funding to support a number of the positions that were in really key positions. And as one of the senior officials at CDC said, the chaos that you see at CDC, who resigned, said that the chaos that you see at CDC is then transmitted to the local jurisdictions who have had to reduce their force, limit the number of people they have working in key areas. So, and these are really, serious. I just have two examples of how these cuts have affected those of us here in Washington. The first is vaccinations, okay? So the Washington Department of Health anticipated getting about $9.5 million from CDC for, vaccine services for really sort of the essential recommended vaccines. Instead, they received $7.8 million. And, according to an article that was in the Seattle Times, it said, what does this mean? Fewer kids are going to get shots through the state's childhood vaccine program. It meant that there are going to be challenges in expanding access to shots, updating data, dashboards, and offering vaccine education. And then the state has this caravan program. It's basically this mobile health clinic that serves people across Washington state. And it's basically has had to stop giving shots to COVID, flu, and childhood vaccines. And then one final example of what these public health cuts have meant to our workforce and to our ability to respond in Washington. Funding has been terminated to the Washington state for mental health, substance abuse disorder, and other public health programs. So the Washington Health Care Authority and Department of Health had to instruct about 200 contractors and providers to stop work. It's impacted crisis response, outpatient treatment, housing, school-based programs, community-based behavioral health, hundreds of small providers, community organizations, and tribal programs, according to the Washington State Health Authority, are going to see immediate financial impact. So that is talk about gutting of support for the nation's public health agencies. The second thing I'll talk about is how we've ignored science and promoted unproven, false, and misleading narratives. And the example here, of course, will be vaccines. So many of you probably remember this press conference. I don't have time to talk about Tylenol, but I can talk about this during the questions. But this is basically where Secretary Kennedy has promoted anti-vaccine hypotheses that included the association between MMR, measles, mumps, and rubella vaccine and autism. Okay, and of course this resonated with I love this here. President Trump standing at the lectern offered Americans medical advice that, this is the same guy who talked about injecting bleach for COVID, so certainly contradicted advice. And it's not only been, RFK, and we can talk more about this during the question, but RFK has staffed Health and Human Services with supporters of this vaccine autism hypothesis, including he hired one researcher supposedly to study this association who promoted unproven cures for autism at $5,000 to $6,000 a pop and was fined for practicing medicine without a license and among other things. So these are definitely worrisome. So again, there's so many things to talk about, but I'll just pick one example, and that's something that's very current, which is measles. So measles, if there were 10 people at this table here, and all of them were immune, were non-immune to measles, were susceptible to measles. Measles is one of the most infectious diseases that you can have. It's estimated that if you have a susceptible population, about 90 to 100% of people who are exposed to somebody with measles will get measles and will get sick with measles, okay? The other thing is measles is more than just a simple rash disease. So about 1 in 10 children with measles are going to develop ear infections, which can lead to hearing loss. About 1 in 20 children with measles are going to develop pneumonia. It's rare, but about 1 in 1,000 with measles are going to develop brain swelling that can lead to seizures and significant brain damage. So measles is not a trivial thing to be worried about. The good news is we have a vaccine for measles, okay? And, the vaccine is given at 12 to 15 months and then at 4 to 6 years. It's 97% effective with 2 doses. Duration of immunity is lifelong. And, before we had this vaccine, there were 500,000, 500,000 cases of measles and over 400 deaths that were occurring every year from measles. So this is a remarkably good vaccine. So where did this whole, autism, measles thing come from? And I have to take a side and talk about this paper, okay? Because this is where when we talked about disinformation, they always say, well, where does this all come from? This is where this all came from, okay? This was a 1998 paper that was published in The Lancet by an author called Wakefield. And his hypothesis that was in this paper was the measles vaccine caused bowel inflammation. The bowel inflammation caused abnormal absorption, and that abnormal absorption then led to abnormal neurologic development, which then led to autism, okay? Couple problems with this, okay? When I used to actually teach, I used to actually use this as an example of a bad paper. So in the interest of time, let me just say two things about this, okay? First of all, Wakefield was previously hired and supported by a lawyer who was suing vaccine manufacturers, okay? He cherry-picked the 12 kids that were in here, who, by the way, were subject to a number of invasive procedures to support his hypothesis. He wanted to develop a business model to treat autism and develop a new vaccine for his profit. None of this was disclosed to the journal before it was published. The other thing was in the British Medical Journal, then a researcher then went back and looked at the cases of these 12 kids who were in this report, and in none of the cases was he able to totally confirm what was in this paper, okay? Either they didn't have the illness or the timing was all wrong. Like, he said, there was like, vaccination and bowel inflammation and either the timing of when these illnesses developed was all wrong in relationship to the hypothesis that he had. The paper was retracted as fraudulent. A number of the co-authors took their name off of it. Wakefield lost his medical license. But, the point is that this hypothesis has continued up until the present time. And if you look at some of the stuff that's coming out from Robert Kennedy and from some of the anti-vaccines, and again, we could talk more about this, but I'll just say this very quickly. They talk about two quote-unquote vaccine contaminants, okay? And I have to say just a word about each of them. One is this thimerosal. What is thimerosal? Thimerosal is a mercury-based preservative which had been used in multi-dose vaccine vials to prevent contamination by harmful microbes. Well, a couple things about this. First of all, it's a different type of mercury than the one that builds up the toxic levels in the body that you've heard, maybe from eating certain kinds of seafood or whatever. This one is broken down and rapidly cleared from the body. But more importantly, despite the lack of evidence, because people were concerned about this, it was removed from all the child vaccines 24 years ago, and MMR never contained thimerosal at all. Okay, so that's thimerosal. The other one that is talked about is aluminum, okay? Aluminum is added to certain vaccines in minimal amounts to strengthen the immune response. It's called an adjuvant. Aluminum is naturally present throughout the environment, okay? It's present in plants. It's present in soil and water, many foods. If you have aluminum cooking pans or whatever. And the vaccine contains a fraction of the amount that most people ingest per day. But I'll talk even more importantly, a number of studies have found no association between aluminum-absorbed vaccines and neurodevelopmental disorders. And I'm going to talk about that right now. So Denmark has this incredible system of medical record keeping. They basically have these record keeping where, they know when people are born, when kids are born, they know what illnesses they've had, they know what vaccines they've gotten. It's this amazing repository of data. So this is one report where they looked at over 500,000 kids, okay? 82% received the MMR vaccine. They looked at 700 plus kids who had either autism or other autism spectrum disorders, and there was no association, none. And many studies have looked at this and have not found an association between MMR and measles, mumps, rubella vaccine and autism. In terms of aluminum, there was another study where they looked at over 1 million kids that were born, and they figured out the cumulative aluminum exposure from vaccination during the first 2 years of life, and they looked at 50 different disorders, including autism spectrum disorder, again, no association. What's an interesting story about this was when Robert Kennedy heard about this, he tried to pressure the journal, the Annals of Internal Medicine, from not publishing this study. And to their credit, the Annals said, no way, okay? And they went ahead and published it. But he said that it was deceit and propaganda stunt by the pharmaceutical industry. I'd say it was good science, personally. So there you go. Let me just say a word about autism in the interest of time. I have a lot of understanding and sympathy for parents who have kids with autism. I have, in my own family, extended family members who have children with autism, okay? It is a serious health issue, okay? There have been an increase in the number of reported cases, although it's felt in large measure that this reflects either improved awareness and diagnosis, so there's more screening going on, which is a good thing, There's also broadening of the diagnostic criteria. So for example, what used to be called Asperger's is now considered part of autism spectrum disorder. The etiology of autism is not entirely clear. There definitely seems to be a genetic component. There may be, maternal factors. There may be other exposures. My problem is that by having false claims about what might be the cause of autism, what it does is it turns our attention away and turns the focus away from efforts to really try and find out what are the true causes of autism. And I think that's where we need to be doing that. Well, are there other harms to the measles autism and thing and measles autism hypothesis? And the answer is yes. Unfortunately, we are seeing a decrease in, which I'll talk about a little bit more in just a second, in vaccination rates. And because of that, we are seeing explosive outbreaks of measles occurring around the country. I just updated this morning, and a report just came out on November 18th. There have been over 1,700 confirmed measles cases, over 46 outbreaks reported in 2025. A couple of deaths. And by the way, it's not just a kiddie disease. So a third of all of the cases of measles that have been reported have been in adults, and 92% were either unvaccinated or had unknown vaccination status. As horrible as that is in terms of the health, in terms of our health resources, these outbreaks are serious. And so there was an outbreak in Clark County here in Washington back in 2019. It was estimated that the total societal cost of managing this outbreak was over $3 million. Okay, there were sick kids at home. If you had a susceptible kid who was exposed, who was definitely going to get measles, that meant the kid was at home as well, waiting to get measles. The parents were home. Ill people were unable to. So, all of these things, the cost of the societal cost, the loss of production costs, the public health response, taking care of people, all of these things. More recent outbreaks, for example, the outbreak, controlling the outbreak in Texas, was estimated to have a cost of over $10 million. So these are not trivial things at all. To talk about what's happening in Whatcom County, again, I'll just have to talk real quickly, and you've probably heard this concept called herd immunity. So herd immunity is essentially if, let's say, this room, okay, if I stood up here and I had measles, okay, if a large percent of this room was vaccinated, okay, and that meant that you were immune to measles, even if one person spread measles to somebody else, if you have enough people who are immune, it basically creates a firewall. So you don't continue to have measles continuing to spread in the population. So basically, herd immunity is the resistance of a population to the spread of an infectious agent based on the immunity of a high proportion of individuals. Does that make sense? Yeah, okay. How are we doing here in Whatcom County? Not so great, okay? This was an article that was published in the Cascadia Daily News, which looked at how many local kindergartners had vaccines, and they said that 86% of Whatcom kindergartners had the measles, mumps, and rubella vaccine, short of the goal of 95%. Actually, when they looked at all of the vaccines, it was less than 82% fully met the state immunizations requirements. The rates are going down compared to 2019. We're less than the statewide rates, and a number of schools had rates of less than 50%. There were a couple that were less than 30%, okay? And so it's not trivial that the Whatcom County co-health officer said many schools are at risk of an outbreak if an infectious disease like measles comes into their school. And I don't think it's a question of if, I think it's a question of when, frankly, that we're going to see it. And then finally, to leave this topic, it's not just measles, okay? Here in Washington, we're also seeing a number of cases of whooping cough. Whooping cough can either be mild or severe, but especially in babies, it can lead to, temporary cessation of breathing, can lead to lung infections. 1 in 100 cases can be fatal. And we're seeing, compared to 2023 and 2024, we saw a 25-fold increase in pertussis and of 194 infant cases in 2024. 87, and the infants are the ones that we really worry about. 87% were old enough to have received the pertussis-containing vaccine, and we've seen cases in Whatcom County as well. So that's vaccinations. Okay, topic 3 is cutbacks in medical research. Okay, and so basically, Health and Human Services has cut over $9 billion in grant funding that was previously approved. And what I really want to talk about is NIH. Okay, NIH is the National Institutes of Health. It's sort of the premier agency federal agency. It has a number of divisions that deal with things like cancer, that deal with infectious disease, child health, diabetes, digestive disease, kidney disease, etc. Okay, and over 26, it says, as you can see, over 2,600 grants have been terminated. And just to say how important this is, if you look at 356 drugs that were approved from 2010 to 2019, all of these different drugs, NIH funds in some way contributed, and these were, often grants that were given to colleges or universities or medical research centers, contributed to 354 of them. So basically, NIH has really been an incredible foundation of medical research in this country that has led to the drugs that prevent and cure disease and so many other things. And a report just came out, this is one of the things I was doing last night as I was updating this talk, that said that between February 28th and August 15th, 383 clinical trials have lost funding. These are trials for cancer, heart disease, respiratory disease, metabolic disease like diabetes, mental health, trauma, neurologic disease, reproductive disease. And over 74,000 individuals are now unable to participate in these studies because of these clinical trials that have been cut. Okay, again, in the interest of just picking one thing, I'll pick something called mRNA. You guys have probably a number of people have heard about what is mRNA. Okay, so why was this such a big deal? So Robert Kennedy canceled nearly $500 million in grants and contracts for developing mRNA. He said mRNA vaccines don't perform well. They don't work against viruses that affect the respiratory tract. Okay, couple things. This was, by the way, as you probably all know, the technology that was used to develop the COVID vaccine, which, by the way, two researchers won the 2023 Nobel Prize for. And it was also, by the way, developed during the first Trump administration, during Operation Warp Speed. Okay, and cancellation affected 22 different projects. As I'll talk about later, these technologies have also been used against other infectious diseases like bird flu. So this is a big deal. What is mRNA? And why is this such a big deal? Okay, so if you remember your biology, or for those of us who don't, DNA makes RNA, RNA makes proteins, and proteins are some of the basic structures of the body. Okay, so what happens is there's an mRNA which is made in the laboratory. Okay, and once it's inside the cell, basically it produces instructions that says make this viral protein. And in this case, the viral protein is a small protein that is on the outer surface, on the outer membrane of the COVID vaccine. And the idea is that when your body sees this protein, then it's going to, as it identifies it as foreign, it's going to mount an immune response that provides immunity against the actual virus. Why is the mRNA vaccine such a big deal? Well, first of all, it allows us, in some vaccines you actually have to grow the virus. For example, in the laboratory, mRNA, we can develop vaccines much more quickly. We don't have to, for example, grow the virus. It doesn't contain live or whole viruses. It targets a specific protein, so it can be more specific. And this takes place in the cell's cytoplasm, so it doesn't get inside the nucleus, doesn't interfere with the cell's DNA. So, is this vaccine any good? Okay, I said here older ages. Maybe for this, I will say not younger audience. Okay, so for those of us who are not younger, okay, and this was a study of veterans with the average age of 71, 99% got the vaccine. I'll say that first, the COVID vaccine is not perfect. There are a lot of issues with it. It only provides partial protection against infection. Immunity does wane over time. So over a number of months, the immunity does wane. The virus is constantly changing. So that's why we keep getting the boosters. So, it's far from perfect. And for example, so in this study, the efficacy, viral efficacy, when they talk about the way they do viral efficacy is they look at the number of people who got the vaccine and how many of those got the disease or infection. And they look at the number of people who didn't get the vaccine and the number of people who then got the disease or infection. That's what efficacy is. And so in this case, most important, it had some protection against infection. I think it was something like 39% in this study. But most importantly, at 6 months, it reduced by 2/3 the risk of getting COVID-associated disease. So it's pretty good for the most severe complications. And if we look at the number of lives saved, okay, a couple of points. One is, the number of lives saved across the spectrum are pretty good, from even at the younger ages, but particularly as we get into slightly older ages, okay, we can see that the number of lives saved is really substantial. So it's really good. It's also really good in younger people. And I'm just going to say two really quick things. One is this, I just found this morning, okay? They basically, this was a study in obstetrics and gynecology. They looked at a huge number of live births. That just came out of one of the Boston hospitals. And they looked at 861 pregnant women who had SARS-CoV infection. This was during 2020 and 2021, so it was at a time before the vaccine was widely available. But what they found was, which was I thought was really interesting, is that if a pregnant woman got COVID infection while she was pregnant, it was associated with an increased risk of adverse neurodevelopmental diagnoses. So, for those of us who are concerned about neurodevelopmental diagnoses, actually COVID is a risk factor for that. And so the American College of Obstetrics and Gynecology have said COVID vaccines are effective at reducing morbidity from COVID complications in pregnant patients and their infants, and it's safe with no evidence of increased maternal pregnancy or infant outcomes. And even talking about kids, there was, as a number of long COVID. Long COVID is a series of complications that come up after you get the vaccine, which can lead to cognitive difficulties, fatigue, loss of taste, smell, body, and joint pain, other things. And what they actually found out, I thought this was a really cool study, where they looked at over 1,000 kids between the ages of 12 and 17, and they found that the risk of long COVID was reduced by 1/3 in vaccinated versus unvaccinated. So even in younger people, the risk of long COVID is decreased. Oh, after they got COVID, thank you. That's what happens sometimes when my mouth gets ahead of my brain. So, thank you. After they got COVID, okay, rewind. After they got COVID, the risk of long COVID was 1/3 lower in vaccinated versus unvaccinated participants. Thank you. Okay. Why has this been a big deal? This has led to tremendous confusion. Where does the confusion come from? Okay. So because of all of these considerations, in June of 2024, the Advisory Committee on Immunization Practices, the CDC group, recommended COVID vaccine for all people 6 months of age and older, and the Food and Drug Administration approved or authorized under emergency use authorization the 2024-25 mRNA vaccines for people over 6 months of age. Until, the newest administration comes in, and Dr. Prasad, who replaced the FDA head who was forced out by Robert Kennedy, he's now named the Chief Medical Officer and Science Officer. He basically overrules his own FDA scientists and said no one under 65 is eligible to receive mRNA COVID vaccines unless they have medical conditions putting them at risk of severe disease. And the ACIP, the revised ACIP, again staffed by RFK appointees, said now it's a personal choice for each individual rather than a standardized recommendation. This has led to incredible confusion, okay? And, you know, if a doctor gives a vaccine, and is he giving it off, he or she giving it off label? You know, what if there's a problem? Can pharmacies give? Is it available at pharmacies? Do you need a prescription if you're a pharmacist? Is it, most important, is it going to be covered by insurance? Okay. And a report that came out in early November from the Kaiser Family Foundation said that this confusion, which has been, every state is doing something different, and has really led to lower COVID rates and a hodgepodge of rules about access and what you can do. All right, last thing I'm going to talk about is global health and how we've abandoned our support for global health. So, as many of you know, the World Health Organization, since 1948, we've been a member of the World Health Organization. Bipartisan administrations have supported this, okay? Until days after taking office, President Trump, in a unilateral action without congressional approval, removed us withdrew from the World Health Organization. We've had a number of interactions with the World Health Organization. We collaborate on the polio initiative, okay? Which basically, when this, when it was started out, polio is present in more than 125 countries. We've made huge progress, but it's still present in a number of countries, like in Afghanistan and Pakistan and Nigeria. So we need these initiatives. George W. Bush, started the President's Malaria Initiative for prevention and treatment. That's another collaboration with the World Health Organization. We have sent more than 1,000 people collaborating with the World Health Organization to control Ebola outbreaks, to prevent international spread. And what I want to talk about for a second is the Global Influenza Surveillance and Response System. That's a network of over 150 labs in over 120 countries. We host one of 7 WHO collaborating centers to monitor influenza viruses. Okay, so quick word about flu. The flu virus is constantly changing, okay? It's constantly mutating to evade and adapt to the host response. And basically every year it changes a little bit. We call that antigenic drift. And that's why we get a flu shot every year, because the protection that you got against last year's model isn't fully protective against this year's model. The problem is, if we get a major abrupt change resulting in a new subtype that infects people for the first time, for example, if a flu virus from an animal population like birds or pigs gains the ability to infect humans and is different enough that most people don't have the immunity, we may not have time to develop the vaccine. We may not have enough of the antivirals. We definitely don't have the immunity. And that can result in a global pandemic with increased hospitalizations and deaths. And that's why this bird flu thing is such a big deal, okay? It's a new strain of the influenza virus. It's present throughout wild birds, present in many poultry flocks as well. You have these flyways, and so it spreads. It's present in a number of dairy cattle in 18 different states. And even for the cattle, it's not a great thing because it leads to decreased feeding, drastic decrease in milk production. Gosh, I don't have time to talk about raw milk, but pasteurization does kill it, okay? Although, there have been issues with raw milk. We can talk about that during the questions. But we are seeing cases so far in humans. Those have all been so far from people who've been exposed to animals. So it's the direct animal contact. And in fact, interesting, I just read last Thursday, a Washington resident tested positive for H5N1. It's an older adult with underlying medical conditions, and this person was hospitalized with respiratory distress, high fever, and confusion. So, this is something that we really worry about. We also worry about, I mentioned the flu virus is constantly adapting. And so, for example, if it gets into mammalian populations, okay, and it begins to develop greater mammalian adaptation, the worrisome thing is if it does eventually develop the capacity for human-to-human transmission, okay? And if we don't have, I should say, by the way, we rely on WHO surveillance data for our regular flu vaccine. So every year, what the WHO does is they look to see what are the most important emerging strains of flu that are circulating around the world, for example, in the southern hemisphere. And we use that to develop the vaccines that we have all been taking. That's where we get that early warning information. If there's a big flu outbreak that occurs from bird flu, H5N1, and we don't have that WHO guidance, we're losing access to this critical outbreak data and WHO guidance on emerging health threats, as well as the ability to develop vaccines. And some of these strains that are circulating so far that have not been human to human, but are affecting people, are not trivial. So for example, in a 4-year period, there were 102 sporadic human infections with bird flu, again, all from animal sources, but 10 of those resulted in death. And just again, if you take one country like Cambodia, in just a couple month period, there were 9 cases in Cambodia and 4 deaths. So these bird flu strains that are circulating are not trivial. And if we get human to human transmission of this virus, we're going to be in trouble. That's why we need the WHO. Again, in the interest of time, I'll just do this very quickly and then just say some concluding remarks about how we can help to prevent this. USAID, okay. USAID was established in 1961 to provide humanitarian assistance, support economic growth, and self-resilience. Some of the biggest projects, it does food distribution, agriculture, clean water, sanitation, poverty alleviation, humanitarian assistance, and health are some of the largest things that have been funded, okay? And as many of you know, USAID has been decimated by the Trump administration, okay? So, within the first 2 months, within the month of taking office, all foreign aid was frozen. Senior USAID staff were placed on leave. Hundreds of others were let go. Within the second month, the USAID website was taken down. The USAID building in Washington was closed. 83% of USAID programs, over 5,000 contracts were terminated. And this has caused enormous confusion in our global partners, okay? It means no program staff have been paid. It means no services have been delivered. It means medicines and foods in some cases are sitting on the shelf and not used. And there was no warning on this. So all of a sudden, these places are left. Clinics have had to close. They basically were totally short-sighted on this. So how has this affected us? I'll just give 3 quick examples. One is, this is a project that I worked on, and these are, I have like tons of numbers, but I can't leave this topic without talking about some faces, okay? This is a project that I worked on, that we headed up, that got a grant from NIH, by the way, which was community support workers. These are all people living with HIV who were trained and who were supported, who in turn provided education and social support to other HIV people living in villages and communities. This was an incredibly successful program. We got to know a number of these people. I mean, a number of these people consider friends and colleagues, and I just had the most amazing respect for these people. And these are many of the community support workers that were supported by this project. A lot of the funding for HIV was through the President's Emergency Plan for AIDS Relief, which was supported by George Bush. These people were supported by drugs that were supported by the President's Emergency Plan for AIDS Relief. I don't know what's going to happen to these people with the USAID funding cut, but these are the faces of these people that are affected by this. I was going to talk about TB. I'll just say, TB is a huge problem. It's a problem around the world. If you have TB disease without treatment, half of the people are going to die. And why does this affect us here at home? Well, it turns out that, of all of the cases of TB, 3/4 of TB cases in the United States are in foreign-born persons. In 2024, we've seen the largest number TB cases in Washington have been the highest number since 2007. And again, 72% of all cases in Washington have been in foreign-born. Okay, well, what does this mean? Typically what this means, okay, is that most cases of TB in foreign-born persons are in people who have latent or dormant TB, okay, so TB infection. It's reactivated when they come to this country here. and it can be prevented if they are screened and treated for this latent or dormant infection for TB. Why are we concerned about this? I'd say for two reasons. Well, one, we don't have time to talk about this, but I think it's certainly arguable that the current policies in terms of immigrants and refugees, are they going to be less likely to seek medical and preventive care? Okay, and I think there's a good argument that can be made for that. But the other argument is, in terms of USAID, is if we decrease the TB burden abroad, then we decrease the risk of infected people among new arrivals coming to this country. Okay, so this is why it's important to us. And the last thing I'm going to talk about is measles. Okay, the measles conflagration, as I've talked about, is out of control already. Okay, it's here. Okay, but cases that are coming from other countries can help to spark new fires of measles that can occur, fueling the epidemic that's occurring. Okay, and in fact, here in Washington, okay, we have had cases of an unvaccinated person who traveled to an area where there was a measles outbreak and then brought that back to Washington, sparking an outbreak. So the point is, if we decrease measles in other countries, we decrease measles coming here. Okay, so let me conclude by talking about how do we prevent this. And the point of it is basically, we can't close our borders. Measles, TB, Ebola, any of those things, any of the diseases that are just a plane ride away, okay? And the question is, are we going to be ready for the next pandemic when it occurs, okay? Well, the good news is, the bad news is there was an analysis that was done of historical data on epidemic frequency and geographic distribution, where they looked at things like, a number of these outbreaks that were occurring. And what they said is most likely, these new outbreaks, the next pandemic that occurs is going to be spillover from wildlife hosts to humans. And we've seen that in so many cases. I talked about bird flu. Ebola is thought to come from bats and chimpanzees. HIV is thought to come from chimpanzees in West Africa. COVID, the leading theory is it's from bats and intermediate animals that were in live animal markets, okay? And they said there is a 50% chance of another global pandemic as deadly as COVID in the next 25 years, and it's probably going to come from low-income countries. Have we done anything to prevent this? And the answer is yeah. The good news is that for a number of years, okay, the United States, and launched in 2014, okay, supported a global security and pandemic preparedness with funding and technical support to improve the country capacity for the prevention and early detection and effective response to infectious disease threats, okay? So these were, a global network of private and non-governmental organizations and international organizations with like CDC, Department of Defense, Health and Human Services, and the State Department, okay? And that really is to improve the country capacity to basically for the early detection and effective response to infectious disease threats. The problem, okay, is that the Trump administration stop work order has frozen all USAID-based global health security programming and services. At USAID, a number of global health security implementing. There used to be 50 people working on this. They cut it down to 6, and those 6 people faced an uncertain future. I talked about cuts at the CDC, at the Department of Defense. Global health security staff, up to 75% of those staff were let go. So basically, at the moment, we have really withdrawn our global health security status. And so are we going to be ready for the next pandemic? And I would say, based on the cuts that we're currently seeing, the answer is no. Okay, a lot of downer information. So is the glass half full or half empty? Okay, and let me say, somebody said it's empty. Okay, but there are a few points of pride, and I have to say one of them is our state, in particular our state of Washington. I really want to give kudos to that. So in vaccinations, as you know, a number of states, including Washington, formed a West Coast Health Alliance for vaccine recommendations. A number of Northeastern states have formed a Northeast Public Health Collaborative. 26 states, including Washington, allow pharmacists to administer COVID vaccines without a prescription. Washington has actually issued a standing order that allows COVID vaccine for everybody over 6 months of age. 13 states, including Washington, allows state-regulated health insurers to cover COVID vaccines at no cost. So the states have really been stepping up, and just recently, just last month, 15 states formed a Governor's State Public Health Alliance. It's a hub for governors and public health leaders to monitor infectious disease outbreaks, establish public health policy guidance, prepare for pandemics, buy vaccines and other supplies. So the good news, it doesn't replace what's happening at the federal level, but the states are stepping up, and I think we can be proud of Washington in that regard. And the last thing is, they always say, what can we do at this, And I would say there's a couple things. One is protect yourself and your family, get vaccinated, okay? The second is it's really important to be informed, and a number of people, unfortunately, and sometimes we just kind of get in these bubbles of looking at what's on social media or what's on AI, what AI does, which basically, calls all this, whatever's on the internet. So it's really important to check our sources, advocate with our legislators, write letters to your senators, to your representatives. There's a number of organizations like Stand Up for Science, Physicians for Social Responsibilities. Write letters to the editor. The Cascadia Daily News is great, the Bellingham Herald, the Seattle Times, or whatever. Talk to your local organizations. One of the things that they talk about is we really need to reframe the narrative away from the negative and talk about the positive. Rallies and other events and vote. So, okay, I've been standing on the soapbox here, so I'll get off of the soapbox and answer questions. And thanks for your attention, allowing me to shovel all this into a talk.
Is this on? Okay. I'm going to stand over here so our mics don't fight. I've got two people, actually Jill and Jay and Amy, thank you. I think we're all set in the audience. But while they're getting organized to take your questions, and can I just see a show of hands of who has questions so I can get a sense of? Okay, hang on one second.
We can start over here.
Well, I have a question before we get started, Jill. Thank you. You talked a little bit about the importance of staying informed.
Yeah.
And with so much misinformation, and I'll be polite, out there,
Yeah.
do you have suggestions for where we can get reliable information as we try and sift through all of this stuff?
Yeah, I've thought a lot about this. It's really funny. My go-to answer used to be go to CDC. Unfortunately, it's interesting, a lot of the CDC websites have been changed to reflect the more current administration thinking about these things. So I think there's a couple possibilities. One is, I think our state health department is great. So kudos to our state agencies. So I think going to the Washington Department of Health is a good source. There are a number of clinical centers. The Mayo Clinic has great stuff on its website. University of Washington, I think, has probably great stuff on its website. The Cleveland Clinic, so that's the second one. A number of professional organizations like the American Pediatric Association, the Academy, AARP has a number of information about this. And then I think most reliably, I still have a lot of confidence in our local doctors and healthcare providers. And somebody did a survey, and it still turns out that most people, one of the most reliable sources of information they have is from their own physician. So it's tough, and sometimes, when you do stuff, Google, the first thing that comes up is AI, and we can talk about AI, which basically culls everything that's on the internet. But there are a number of reputable sources out there, and it does involve a little bit of digging, but there's good sources of information out there. Oh, thank you so much. Yes, that's right. National Library of Medicine. Kudos to the National Library of Medicine, and thank you. Yes, the National Library of Medicine is great, and they have access to all of the articles, for example, that you can get, abstracts and information, both professional and public as well. So thank you for for pointing that out. That's absolutely true. Other people can join in other stuff
We
too.
have a question
But I'm
back
glad you
here.
mentioned that. Thanks. Yeah.
Thanks a lot for an excellent, although very discouraging talk. My question is, how did politics get mixed up in all of this public health stuff? When COVID started, I thought for sure that would be completely apolitical. We would all come together and fight the disease. Boy, was I wrong. What's your explanation for why politics is so prevalent here?
So I think, kind of let me expand on your question. We look at all these sources of like disinformation, and where does all this disinformation come from? And I think the way I think about it in my mind is I sort of try and parse it out between the sources of information and the recipients of information, okay? The sources of information I have a lot less sympathy for, okay? And I think some of it is definitely for political advantage, speaking to the base, trying to get the base riled up, about things, particularly with the, anti-science, anti-public health. And, I actually had colleagues, for example, at the Minnesota Department who were getting death threats. And one of the books I think back there is the Fauci book, one of my heroes. And he talks about, the incredible political blowback that he got for really standing up for science. There's also, I think, for a lot of people, there is a profit motivation with some of the disinformation, either from websites or alternative, production, like, some of these false, cures for COVID or other things. Lawsuits, RFK, for example, collected over $2.5 million in fees over 2 years related to a lawsuit where he was suing the HPV manufacturers. So I think there's a lot of personal interest that goes into this. I talked about this father and son that were promoting this autism link, and they basically were selling these cures for thousands of dollars a month. The recipients, I think, are tougher to talk about. And I think in the recipients, I think there's no single, I look at this sort of as a spectrum. There's some people, and all of us who have had this experience of trying to talk to family members or friends about this, and in some cases, it's really hard, But I think there's a lot of people sort of in the middle who really are truly confused by what they hear. They hear things in the media, they see things online, and they're truly confused. And so I think, sort of our goal is really to sort of reframe the narrative and to be talking to people and to try and counteract these things. And one of the things I think the way we do this, I'm sort of spinning off from your question, but I think one of the ways is there are certain values that we all hold. We all want our kids to be healthy, for example. We all want our populations to be disease-free. And I think if we can approach people with, kind of what we all share in terms of a sort of a basic humanity, maybe we can help to respin the narrative. So I can't give you a total answer, but those are a couple of thoughts. And
As we get ready for the next,
yeah,
We have a question up front, please.
Is there a way that the states and those state alliances can collaborate directly with the WHO to end around the federal drama?
That's a really good question. I don't know. It's a great question. I think I would say, again, individually, I think there probably continues to be communication. So I think there's a couple issues with WHO. One is sort of the person-to-person, issue, and I'm sure there are a number of people. I know there are a number of people who are continuing to collaborate with WHO on a individual basis, or reporting and getting information. I think the issue is because of the loss of federal support, there's also a loss of funding for a lot of the core, really key WHO activities. And I think that's a gap that's going to be really hard to fill. But hopefully there can be, continued communication among concerned individuals around these issues. But I think the resource and funding issues, and frankly, the lack of U.S. a number of these were, big organizations like CDC, Department of Defense, USAID, that were really collaborating with WHO, and those are going to be really hard to replace. So I think we'll do what we can, but the hit is pretty big.
As we get ready for the next questions, I just want to remind you that not only is Dr. Fauci's book available, but also a specially curated collection of books brought to us by our friends from Village Books. And I urge you to take a close and careful look at them while you're here today.
Any questions in the back?
I see one now.
My question is, if one had measles, a raging case at age 5, does that confer lifetime immunity, or am I susceptible and should get a vaccine?
You're good.
Thank you.
And you're also protected.
Thank you, doctor. How about my
Question-
knees?
We have a question up front.
Yes. There are,
Oh, and I would just say, I'm sorry, yeah, measles is a good example of one. Yeah, anyway, sorry. Okay, I'll stop. Hi.
if the federal government steps back from all of this for whatever reasons,
Yeah.
can states step up to this and provide programs for making vaccines and distributing vaccines? And how do you think that would work? And then there's one other place for people to seek help if you have enough wealth, and that is to fly to Europe or Canada and get a vaccine.
Yeah, okay. So I think there's a couple of, those are great questions. So let me try and parse out a couple of things. I think there's a couple of things that states can do, okay? One is, like in Washington, for example, we now have a standing order that says that, anybody, I just got my COVID vaccine at Walgreens a while ago. So, standing order that says, for example, pharmacists, so access, I think we can definitely improve on access. The second is, a number of states have said that the state-supported Medicaid programs can support, paying for supporting the vaccines. And I think Washington has been very good on that regard. So in that regard, I think that's really good. So I think in terms of access, in terms of educating physicians, and again, Washington can do that. So I think there's a number of things that we can do. The concern is, everything is a yes, but the concern is we can definitely make it easier, and we can certainly provide some support. The question is, how do we counter all of the negative anti-vaccine information that's going on out there? And so that, to me, I think that's the worrisome thing. So, for example, the number of people that, for example, in Washington, as I talked about, but also across the country, that are, where the kids aren't getting vaccinated is continuing to go up, And so I think, to the extent possible, our state health departments and others, can really help to promote education campaigns, to work with the schools, to work with others. I think we'll do everything. And I know our state health department, and I know our Whatcom department is working very hard on that. But it's hard to counter the whole flood of misinformation, particularly when it comes from the president,
Jill?
and Health and Human Services. So we do what we can, but it's.
Do you have a question back there?
I don't see any hand.
Okay, we have one up here. Jane?
Thank you for your clear and worrisome talk today. How
Clear
long,
and worse,
assuming the next two elections, we have a complete change of administration, government, the
Yes.
top, everything, all the way down, and the projects that were interrupted. How long do you think it will take us to get back to where we were before this decimation took place in 10 months?
I think that's a really good question. I think some of these are, there was actually a really interesting article that talked about the effect of some of these research studies, and they said it may take years for us to get back. And I'll talk about two examples. Well, three examples. If I stand here long enough, I'll think of four. But one is, what's happening to the training of of young professionals. You know, I think that's going to take us. That's a hit that we're really going to be bad. The second is, you know, I talked about global health, and there have been a number of examples of, for example, clinics, particularly in sub-Saharan Africa, but in other places that really, you know, for example, have been providing HIV treatment and doing HIV prevention that have just closed. You know, opening that up is going to take years because of the damage that it's caused. And then also just, you know, there have been reports of, for example, of scientists that either, you know, are the scientists, for example, who are leaving the country, you know, and going to other countries because the medical research opportunities are greater because they've been decimated here in this country. So I think it's going to take us years to kind of rebuild it, but hopefully we can at least what do you call it? Reverse the slide and begin to. But I think it's going to take a major effort, and it's going to be years to rebuild what we've already lost. I wish I could be more encouraging about it, but that's my feeling.
Okay, looking at bigger structural problems. What do you see the interplay between Medicare Advantage and Medicare and insurance companies with the profit motive? And it's on top of all you haven't even brought up that aspect of how it's undermining
Are we
everything.
having a talk on this?
No, well, we are, in fact, we are
I'm
going.
so glad.
Yeah, I think that's out of your wheelhouse, shall we say. And we are going to have a program on healthcare delivery through what are called hospital districts, and that'll be in February. And we'll look at healthcare deserts in Whatcom County and what hospital districts are, how they work, and how they might expand some of the access within Whatcom County. And I think we're going to wrap up on looking at next year before we thank Alan. Don't go away.
Okay.
But just a quick review of some of the programs that are coming up. One is January, where we will look at food insecurity. I think this latest shutdown and the whole discussion around SNAP really tore the blinders off what hungry in America looks like. And the question we're going to answer is, what about us? What about Whatcom County? What is the situation with food insecurity here? So that's the January program. February program is the hospital districts. March, it's the economy, stupid, with Hart Hodges and James McCafferty, who, if you've seen them before, are a great duo in terms of really delving into what's going on in the economy. And April and May, we're going to take a look at a historian's perspective on what authoritarian is. And then on the World Cup is coming to Bellingham. And, you know, we have live venues in both Vancouver and Seattle. We're going to be I know somebody must know what the term is, a viewing play. Fan zone. Thank you, Andrew. A fan zone. So what does that mean to Bellingham? And we'll be able to drive down Holly Street, for example. So we have a whole number of programs. Those are hot right now in the works. We're lining up speakers. Some of the speakers are already on board, and we're already looking at the next tranche of programs. So please keep coming. Please, if you're not a member, please join. If you have ideas, I mean, I have to give a shout out to Sue Wright, wherever Sue is. Sue is a former member of the program committee, and she read Alan's article in the Seattle Times, the piece you did months ago, and noticed that you live in Bellingham. And Sue said, "Get in touch with him."
No good deed goes unpunished.
So that's how that happens. So we're always open to your suggestions on programs. So want to wish everyone a wonderful holiday season coming up. As you may recall, we do not have December meetings. And so we'll see you in January. The January date, I think, is January 28th. It's pretty late. We have to stay away from each other, Alan. It's pretty late in the month, but so appreciate everyone being here. As I say, if you're not a member, please become a member. Please renew your membership. Allison, anything I've forgotten? Yeah, if you didn't hear that, please help our volunteers busing. We have receptacles up there. I think all the stuff is recyclable. And thank you all for coming. And Alan, thank you
Well, my pleasure.
for.
Thanks, Jane.
I cannot tell you how much work this man put into this. We've been talking for months, so thank you.